Trish, you got this recorded?
Yes, sir, you're good.
Okay, all right. Good morning, everybody. So I'm going to talk about advancing quality of life in patients with chronic pain. And there's definitely a literature about quality of life in chronic pain and pain disorders. There's also quite a bit of literature about quality of life in mental health conditions. But there's not a lot of literature about how to advance quality of life. And so I'm going to talk about really where the rubber meets the road and how do you improve people's lives looking at quality of life. So I have no financial disclosures. Here's the objectives. I'm going to define the problem. I'm going to talk about what the dimensions of overall quality of life and health-related quality of life are. I'm going to talk about 4 primary areas of interest, or what I call core quality of life. Then we're going to talk about the quality of time. We're going to develop a strategic plan to address advancing quality of life. Talk about some theory and practice. We'll have a couple case examples, and then we'll have some conclusions. So chronic pain is a health problem that influences patients' lives, causing functional, social, socioeconomic, and emotional changes that all impact quality of life. And so I'm sure you're aware of this in your practice. You see how patients' quality of life is so dramatically impacted by their pain condition. And here's a scale. I'm sorry this is so hard to read, but this is the American Chronic Pain Association's quality of life scale. And it goes from 0, where the person is staying in bed all day, to 10, where there's normal functioning at work and volunteering and social activity is normal. And so there's a wide variety in how much activity and how much social activity and work activity and other activities people can have related to their quality of life. But I think if you wanted to look at quality of life in general, you would answer this question. Overall, how satisfied are you with your life? And you could actually rate that on like an A+ to F scale, like you would in school. So from A+ to F, how satisfied are you with your life? And that kind of answers the question about your quality of life. And your quality of life is where you live emotionally. So if you have poor quality of life, you're not going to be feeling very good. You're going to be kind of dysphoric. And if you have quite decent quality of life, you're going to be pretty happy with your life in general. And quality of life illuminates the burden of disease. So actually, it's my feeling, and many others agree with this, that health-related quality of life measures complement and may even be preferable to pain-specific measures. And so when I work with patients in chronic pain, here in the high-risk pain clinic, I'm often trying to address quality of life issues and not focusing just on their pain condition and whether they're getting relief from their pain, but kind of really look at their quality of life and what's happening there. And this is really tiny, but so in all the quality of life literature and the psychiatric literature, they look at 10 domains of functioning for quality of life. And so you have physical health, mental health, recreation and leisure, marriage, family, social life, environment, housing, transportation, education, work, finances, legal issues, appearance, spiritual life. And so all these domains play a part in overall quality of life. But it's a cumbersome, how are you going to impact all of these dimensions of quality of life? And so people get overwhelmed when they think about this. When I first developed this pie chart, I thought, hey, if I can master this, my life will be perfect. But it's a lot, really. It's harder to do than you might think, just looking at that chart. And then the CDC defined health-related quality of life as an individual or a group's perceived physical and mental health over time. And this is their perceived health status and their activity limitation. And so how does the CDC measure health-related quality of life? They use something called the Healthy Days measures. And so what that answers is how would you say that in general your health is excellent, very good, good, fair, or poor? And now thinking about your physical health, which includes physical illness and injury, how many days during the past 30 days was your physical health not good? And they say the same thing about mental health. Over the last 30 days, how many days, including stress, depression, and probably your emotions, was your mental health not good? And also during the past 30 days, approximately how many days did your poor physical or mental health keep you from doing your usual activities such as self-care, work, or recreation? And so they used these healthy days measures and looked at what parts of the country have the poorest, the most unhealthy days, and who have the fewest unhealthy days. And if you look at this chart, you can see that West Virginia, Kentucky, and Alabama have the most unhealthy days of the country. And so we're a region of the United States that's really suffering with unhealthy days. Interesting, huh? So what I got thinking about is, what do we focus on in quality of life? That overall quality of life is so many things, and health-related quality of life is so focused on health-related issues. And so what I said is, well, let's look at New Year's resolutions. What do people make New Year's resolutions about? And basically, they're trying to improve 4 categories of life: love, work, health, and place. And so if you look at these New Year's resolutions in 2020, that's basically what it was about. And so, they manage finances better, eat healthier, be more active, lose weight, improve mental well-being, improve social connections. So you can see love, work, health, and place are kind of the categories of New Year's resolutions that people naturally gravitate to improve their life. And so I call these 4 categories core quality of life. I'm kind of coining a new term here. And so if you can improve these aspects of life, you get pretty solid at the core, and that's a good place to be in life. And so that's differentiated from health-related quality of life and overall quality of life. Overall quality of life being too many things, and health-related quality of life just being focused on health and the impact of health. Does that make sense? All right. And then I like to read that there's a journal that I like to read about kind of the wealthy lifestyle. And they talk, one interview was talking about how true luxury lies in the quality of time. And so, what is people's quality of time? How well is time spent? It's not forwarding. There we go. And so how do we satisfy quality of time needs? And so quality of time is something that is precious to everyone. It doesn't discriminate. And so you want to build a good quality of time in your life and get as much beautiful quality of time as you possibly can. So not simply to be called a success, but to have good quality of time. And so there's different ways to improve your quality of time. You can adventure and discover and explore and engage and dive into your desires, or ceremonies are good quality of time, or meditative experiences, or like athletes get into the flow or the zone, so you can get into like a flow state in your functioning and activities when the difficulty of the activity matches your abilities. And then you can have a hobby that you do, a satisfying task that's good time, time well spent. And then spending time in a way that's cool to you, that you think is kind of a classy way to spend time is nice. Or small wins. So when you're making progress, that brings happiness, and that's good quality of time. And then maybe the best way to impact quality of time is to host an experience. And so when you host an experience, I think you don't want it just to be an enjoyable experience, but you want it to be an experience that people can spark off, that they take advantage of the experience in some way. And so to me, that's the best quality of time, to host an experience like that. And so what I talk about is a harmony of things. So like when you want work-life balance, I don't think work-life balance is what you're after, a perfect balance. What you really want is work-life harmony, and that's good quality of time. And so it might not be a perfect balance, but it might be a harmony between them. And then Gary Chapman, who's an expert on relationships, he talks about the love languages, if you ever heard of that before. He says that quality time in relationships is undivided, focused attention, quality activity. So there's an emphasis on why you're doing it rather than what you're doing. And quality conversations, so valuing the other person or trying to understand or have depth and humor and interesting conversation and flow, and it's enjoyable, but also managing tough times. So that's quality of time in relationships. And then so what we're hoping for is to not let useless unpleasantness chew up the clock. And then I was presenting this kind of idea to Dr. Risk last year and the fellows, and Dr. Risk was saying, there's something to contentment, that people have a spiritual kind of quality of life that they can enjoy. And so I looked more into that. And Carl Menninger, who's a famous psychiatrist who developed the Menninger Clinic, says mental health is the ability to adjust to the external world with contentment and master the task of acculturation. And so how do you get at contentment? And so Muhammad, the famous spiritual leader, says patience is the key to contentment. And so it's this feeling I'm enough, or I enjoy enough, or a quiet life full of small satisfactions. People savor things, both the future things that are coming up and pleasant things from the past, and you anchor your memories with photos. And so contentment is an attitude of the heart rather than something someone struggles to reach. It's not an ambition, it's more just an attitude of the heart. And people can experience spiritual joy. So spiritual joy is like a surrendering into the way things are, and you get kind of an elevated state or a bliss or serenity by surrendering, a spiritual joy. So that's contentment. But some people argue contentment lacks ambition. So if you're content, are you going to be ambitious and strive for a better life? And so striving for a better life is really about meliorism. And meliorism is a philosophy that says that life can be improved. And so there's two kinds of meliorism: mitigative meliorism and constructive meliorism. And so mitigative meliorism means that we're going to improve life by correcting problems. And constructive meliorism means that we're going to improve life by seizing opportunities to build something positive. And so what I suggest is a balanced approach where you're both mitigating things that are troublesome and constructing positive things. And part of this is to not focus on sci-fi goals and miss out on projects that are going to be valuable for you at this time. So you don't want to be unrealistic about what you're striving for. And then Ariana Huffington from the Huffington Post, she says life is a dance between making it happen and letting it happen. And so you can do so much work to improve your life by mitigating problems and constructing positive things. But part of it is kind of just letting go and letting it happen. And another part of this is advancing your identity. So your identity impacts your health and your quality of life. And the reason for that is that you enact your identity. And so the key here is to not settle for a stunted identity. If you have if your view of yourself is negative and stunted, that's what you're going to enact. You're going to exemplify that with your life. And so you want to kind of develop the strongest and most distinctive identity that you can in your life. And so your actions and your likes and your dislikes prove your identity. And what you can do by strengthening and making your identity more distinctive is create a radical shift in identity, and that'll dramatically improve your quality of life. And then, so if a sailor doesn't have a compass, it's going to be tough to navigate things. And so it's the same with kind of developing a good quality of life. You need a theory to navigate your way along in developing good quality of life. And so that's what I'm building here, is a theory for you to think about how we can advance quality of life in patients who have chronic pain. And so William Glasser in the 1960s, going all the way back to 1960s, developed something in the mental health field called reality therapy. And so reality therapy focuses on realism and responsibility rather than symptoms of mental illness. And so it's focused on the here and now and problem solving and choosing a better future. It's not really about psychiatric disorders. And it doesn't concern itself with the patient's past. And so the key to reality therapy is getting control of your life. And the way that you establish control is by evaluating current behavior and planning possible behavior. And then as an outgrowth of reality therapy, I'm developing a concept called empowerment counseling. And there isn't a literature on this, but there are other people thinking about this in the addictions field, about how can we empower patients to take control of their lives. And so the idea here is that the stronger you are, the easier your life is. And so empowerment counseling is about people believing in themselves through strengthening. And the way you build up empowerment is through by building up historical and contextual resources. So of course they feel empowered. And when people feel empowered, it's visceral. You get a gut feeling of your empowerment. And that really helps with getting control of one's life. And so here's all the kind of examples of ways that you can build up historical and contextual resources. And so some historical resources are things like small wins that you've accomplished, that builds up your empowerment, or any contribution you made or significance you have, or skills that you've developed. Even learning to walk as a toddler is an empowering resource for, a skill that you've developed as a child that makes you feel more confident and empowered. And how much value do you offer your contacts and connections at work or personal life? Your social value, that's empowering. And the confidence that people place in you, in the healthcare field, patients place confidence in us, and that's empowering. It's a privilege to be a healthcare provider. And then competitiveness is empowering. And anything you need to do to correct an insecurity and reassure yourself is empowering. And success along the way builds momentum, and that's empowering. And to me, successful recovery experiences build up grit. And this is something that I want to study. Andrea Doyle and I are looking at studying this in the addictions department about whether recovery experiences from any illness builds up kind of how gritty you are. And then contextual resources are different. So they're more like posture and body language, that you can impact how empowered you feel by that, or the clothes that you wear can be empowering, or the language that you use. If you elevate your language, that can be more empowering. So I'm kind of working on trying to add metaphors to my language, try to use more metaphors to kind of orient people toward things rather than just saying things directly. And so language is an attitude, and you can empower yourself with language. And then even the tone of voice, like the downward sound of confidence in the way that you talk and how strong your voice is, can be empowering. And you can learn by observation and association. So if you associate with people who are more successful, or have more importance in society, kind of swim with the sharks and nestle yourself with this ecology, you can grow and be empowered by the people around you. And part of that also is to be widely traveled or cosmopolitan in your tastes and influences. That can be empowering. And even in relationships, like an intimate relationship, finding someone confident to impress, or a supervisor or somebody, that can be empowering. And then there's something called the social determinants of health. So your zip code can be empowering or disempowering. And so you want to think, what kind of environment do I live in, and how empowering is that? And then groups can be empowering. So there's more resources to groups than individuals. So I hope that makes sense, that empowering people is going to help them get control of their lives so they can improve their quality of life. And then the therapeutic alliance can also be empowering. So if you believe in the patient, when you believe in the patient, it creates something called the Pygmalion effect, which is basically an expectancy effect. And so if you're expecting things to improve in their quality of life and you believe in the patient, they're going to see it in the look in your eye, and it's inspiring. And then sending the right signals. So, what's your body language and your tone of voice say in the way that you're dealing with the patient, and how empowering is that? And then kind of undermining myths and dark psychology that allow abuses of power or undermine the strength of the patient. So, for example, women in society have come a long way, and it used to be that thinking of a woman as a physician was like unheard of. And to these days, that's a normal kind of part of society. But there's lots of disempowering kind of myths that exist in society that we have to undermine. And then you want to instill hope. So I instill hope kind of with a stubbornness, a stubborn hope, or a stubborn creativity, and model assertiveness. So some patients are very passive, and that can get in the way of empowerment. And then share your power. So you can actually kind of share your ego with patients and just let them kind of just take within themselves the power that you share with them. Introject was the word I couldn't think of. And then you want to inspire a dose of rebellion. So, like as people get older, some people think getting older is all a downhill kind of slide, but that you can rebel against that and say, hey, I'm gonna be healthy as I get older and work toward accomplishing things, and this is my second act or whatever. So you can rebel a bit against some of the things that we kind of think about, and that the kind of being a bit of a naughty kid and childlike in spirit helps empower you. And you want to acknowledge contribution and foster autonomy. So when patients do things for themselves and think for themselves in a self-directed way, and that is empowering to patients. And then you want to challenge them, so give them stretch projects to push them to evolve, and even unlock talent. So you can unlock talent by developing the right stance in your relationship to the patient. And this is not just patients, but children or people in your life. The stance that you have with them can empower them and unlock talent. And so you want to support them and challenge them and have an inspiring intensity. And you can even unlock talent with your own style of poetry. So there's lots of ways to unlock talent in people in your therapeutic alliance. And so once patients are empowered, you want to go back to this meliorism, so mitigating problems and constructing a flourishing life, a good quality of life. And so how do you do problem solving? Well, what I would say is you want to look at the pain points, and we want to look at the pain points of this core quality of life. So what love, work, health, place, and their quality of time. And so you don't want them to use avoidance-based coping. You want them to kind of face things, their difficulties head on. And the way you spot problems by tension developing. So when you sense a tension in the patient, that's where a problem lies. And so you can kind of uncover, what is this tension about, and how can we address this problem? And then with the most frustrating stuff, you want to just step back and build a delay tolerance. You're not going to maybe be able to solve a problem immediately. And then there's some know-how to problem solving. So we have published solutions. So of course, in the medical field, we have medical literature and published solutions to problems. And you can get good advice from somebody who has experience in an area that you're working in. And then you can have adaptations from similar problems or analogies from different domains. You can filter the signal from the noise, kind of get rid of the stuff that's not relevant to what you're trying to work on. And you want to define the problem and delimit the chaos, and it's apocalyptic spread. So sometimes problems just kind of get their tentacles into all aspects of the person's life. And so you want to limit that as much as possible and declutter and simplify. And then you need pattern recognition. So apply the mental map or principle to the situation and describe the problem in as many different ways as you can to kind of have fresh eyes and see an old problem in a new way. And you don't always have to figure out what the root cause of a problem is. So root cause is helpful, but a lot of times we don't figure out what the root cause is. And so it's more important to figure out what maintains the problem. And then if you can figure out what maintains the problem, you can fix the process. And when you fix the process, that solves the problem. And then lastly, you can build something positive to solve the problem. And then when it comes to constructing positive things, we can look at the design field. And so Neri Oxman, who's from MIT, I think she has her own business now, but she says we must design where we are going from here. And so how do you design change? Well, you want to broaden and build these areas of core quality of life and start with an idea of beauty. So if you can make your dreams real, that's pretty satisfying in someone's life. And so you got to kind of be fearless and up for the design fight and define the ambitions of the project and get to know the terrain that you're working in and fuse logic with imagination. So you want to just be unrealistic in your imagination. You want to kind of have reasonable things you're hoping for. And then make a way. And you want to think of the alternative routes and decide your future course based on that. And you want to get from concept, narrative to completion. So envision, shape, realize, and be bold. So design with a strong point of view. And then Carol Kaufman, who's an executive coach at Harvard, says if there is a disconnect between who you are and who you want to be, it may point to a different set of internal priorities you need to meet before tackling the one you're going after and missing on. So sometimes there's things going on that are kind of interfering with solving the problem or constructing something that you want to construct. And so one example of this is something called internal family systems, which is a kind of psychotherapy that's new and is very useful. And what it says is that within ourselves, we have kind of concepts of the people in our family and our life and their interactions with us and views of us. And if our relationship with them is not relaxed, you know, if they're not relaxed in the way that we perceive our family members, that can interfere with kind of what we're hoping to achieve in our life. So we have to figure out what can we do to help have that part of me relax so that I can move forward. Does that make sense? So there's kind of internal family systems within our mental apparatus. And then in the coaching field, they say there's an inflection point where someone goes from therapy, where they're needing psychotherapy, to where they're able to be coached. And what that's like is going from the trail of tears to the trail of dreams. And so you see that with patients with chronic pain. You know, when patients are in a lot of pain, they're kind of focused on their pain, and that's what their life is about. And it's kind of a trail of tears. And if you can get them to a point where they're no longer so focused on that aspect of their life, they can kind of move forward and follow the trail of dreams, and then they're ready to be coached into a better quality of life. Does that make sense? So Abraham Verghese, he's my favorite medical author. He's a internist from Stanford. He wrote this book, Cutting for Stone, and he has a new book. I'm blanking on the name of it. But he says in Cutting for Stone to make something beautiful of your life. And so I think that's a great ambition of life, is to think, you know, how can I make something beautiful of my life? And so I think when you do that, that's giving you pretty good quality of life. And the idea here is to launch it a little bit ugly and then build it under the public gaze. So you don't have to have a perfect concept about what you're going to do with your life or, you know, what you're hoping for. You get it pointed in a direction, and then you develop it as you go along. And then also, people take different roads seeking fulfillment and happiness. So just because they're not on your road doesn't mean they've gotten lost. So this is the Dalai Lama says this, and it's so important. So people kind of think, you know, almost in a narcissistic way that everybody has to live like them. And so actually there's lots of roads to good quality of life. And then another important point is that failure is a rehearsal for success. So some people get demoralized by failure and think, you know, there's no way I'm going to accomplish anything. I'm ruined by this. I can't improve. But actually, each failure is getting a little bit closer to the success. It's just an approximation. And so failure is really a rehearsal. It's not just a negative outcome. And back to this recovery builds up grit concept. So, you know, when people are successful, some people have terrible medical problems, and they're usually the grittiest people, you know, because they've been fighting through this stuff. And so they build up this kind of stubbornness and tenaciousness to work on their lives. And so that can be true of any aspect of life. If you recover from it, improve it, you get grittier and grittier. So that's true for clinicians too. You know, you work with difficult patients and you're able to help them, and you become grittier and grittier in your work as a clinician because you kind of struggle through these tough cases and believe that you can help them. And then when life becomes amazing and you just love it, you know that your life is being fulfilled, that your body is truly lived. And so maybe that's the ultimate quality of life, huh? And then quality of life relates to something called positive psychology. And positive psychology is a field that Martin Seligman started back in 1998. And what he said is that, you know, focus on illnesses and improving problems is just a half-baked psychology. And so actually there's a psychology of flourishing, and he called that positive psychology. And so that's about positive emotions and character strengths and virtues and living a life worthwhile. And so says, and you know, the whole field says that attention to the positive sheds light on what makes life worth living. So this quality of life focus is all about improving the lives of our patients. And so we get so kind of preoccupied with focusing on this like one medical point, this focus of diagnosis, and lose track of kind of the whole quality of life that patients really could improve at. And my feeling is that the more life you improve in patients, they kind of lose focus on the problem. Like pain doesn't go away entirely for most patients. And so if we can improve their quality of life, their dissatisfaction with their pain situation diminishes because their quality of life is better. Does that make sense? All right, so some case examples. So these are not actual cases since we're recording this, but you know, from many clinical cases over the years, these are kind of examples of what you would see. So a 45-year-old male with a history of motor vehicle collision, with neck and back injury, multiple surgeries, history of bipolar disorder, never treated before, problems in marriage due to mental illness, separated from wife, socially isolated, depressed, irritable, unemployed, history of opioid misuse from self-management of pain, started on Suboxone for risk of addiction and pain management, treated for bipolar disorder, back to work, reconciling with wife, enjoying more social life, mood much better, no longer irritable, pain much improved, more activity, better quality of life. Just the kind of thing that we would see in like the high-risk pain clinic, you know, where patients, it's all aspects of their lives are coming together with the kind of a multidisciplinary approach that we have to chronic pain here, meeting so many needs and really improving their quality of life. Does that make sense? All right, next case, 30-year-old married female with a history of stimulants, cannabis, benzodiazepine, and opioid use disorders, as well as chronic pain from a right arm injury, has had several arm surgeries with limited functioning now, terrible anxiety, stays in the house all day, unemployed, depressed, detox off the benzodiazepines, depression and anxiety treated pharmacologically, psychotherapy, marriage improved, husband supporting her recovery, staying sober, volunteering in church. Pain continues to arm, but quality of life so much improved, she is tolerating the pain much better. So that sounds like our patients, right? So you don't get total elimination of pain in the majority of cases, but their whole quality of life can improve dramatically. And I think the more we're able to empower patients and, you know, have a reality focus, we can really improve their quality of life. Any thoughts about these cases? Sounds right.
I'm just wondering, like, if the individual who enters into these problems has more contentment, if that would mitigate this pathway. So in other words, you know, if you're stronger and you go to lift 100 pounds, it's easier than if you're weak and you lift 100 pounds. So if you come into this with your bipolar treated and relatively content with your life and no trouble with your marriage, would this cascade have happened? I understand you have to take them as they come, but I'm wondering, you know, it's just like your general health. If your mental health is better, you're going to be able to do more things.
Yeah, I think it frees you up to focus on constructing things instead of focusing on your mental illness or whatever.
And so I lately, well, yeah, since sometime last year, when I was home by myself a lot, I started reading about grit. And I'm wondering, in your world, in the recovery world, you say they develop grit over time, but I'm wondering, is there any data that individuals who entered with more grit are more likely to recover better or longer or stay sober? Um, and would that lead to maybe testing for grit, at the beginning and end of treatment and see if that's changed any?
Yeah, that's exactly what we want to do, and I definitely agree with you. I think that you have to have some kind of challenges initially through your life to develop grit. There's not going to be anything that you've worked through to kind of build up that muscle. So maybe school was challenging, or sports were challenging, or some kind of past experience. But I think illnesses can be an example of an adversity that you overcome that makes you grittier. And the more grit you have, kind of the better you struggle through things. And it's a muscle of kind of dealing with adversity. It's empowering, right?
I agree with that.
Could that like adverse life events scale kind of like play into that?
Well, so the adverse childhood experiences are disempowering in patients, and they're related to illness outcomes. But people who've looked at adverse childhood experiences also want to say, what are the kind of positive things that happen to children that counter the negative outcomes of people with adverse childhood experiences? So what are protective experiences? And so maybe becoming grittier would be an example of a protective experience.
Mm-hmm.
This should be more woven into our stimulator courses, particularly the diabetic side, but all of them, to say, look, this is what we hope for. We're not looking at, we're not going to eliminate your pain completely, but, can you do more? I mean, one of the greatest things I've seen was a woman who couldn't drive, who during her spinal cord stimulator trial went to Walmart. And for her, that was amazingly great experience.
Yeah.
And so I don't really remember what her pain did, but I do remember that she drove to Walmart. You know what I mean? So it's important for me. It must be important to them too.
Yeah. So I'm going to make a point here in my conclusion, see what you think of this. So quality of life is an important goal in treating conditions that cannot be cured. So if you can't cure the condition, can we impact the quality of life of the patient? And to me, quality of life seems more important to patients than providers. So we have to think about, kind of stand in the patient's shoes. What matters to them? And so quality of life is so important to them. And we get so focused on the diagnosis and addressing the diagnosis and lose track of what matters to patients. And then treatment of pain improves quality of life. But also we can focus on this core quality of life, love, work, health, place, and quality of time. And I've really been thinking about quality of time. What can we do with quality of time, and what is the potential to improve quality of time? And so think about, meliorism, to mitigate problems and build a better quality of life, and use reality therapy and empowerment counseling. And then ultimately make something beautiful of your life is the goal of every human being, right? Make something beautiful of your life. And so the art of quality of time is where true fulfillment lies.
I have a question for you. Is there anywhere, like specifically within our system, that this type of counseling would be performed? Like just having that quality of life conversation with the patient and trying to, like, more of a coaching than a therapy, like trying to help them determine certain areas of their life where things could be optimized by problem solving potentially?
Yeah, so I think you want to kind of customize your care to the patient a little bit and sort of meet them where they are. Are they following a trail of tears, and do we need to address these troubles emotionally that they're having? Or are they ready to kind of be coached into kind of constructing things and moving toward a better life? Mm-hmm. And so you want to meet the needs of the patients as much as you can, figure out where they are. And so, we do this in the high-risk pain clinics. We have a group of patients all in different places in their life, and they learn from each other. They hear what they're working on, but we don't just focus on pain alone. We're totally into the whole quality of life thing in those groups, and trying to enhance their quality of life as much as possible.
So if we had someone that we felt like could benefit from this type of conversation, maybe they don't need or want like psychotherapy, but they're interested in more of a coaching approach, is that something we can send them for and just put a little note in there?
I think
Okay.
I think that'd be appropriate.
Because I feel like patients might buy into it a little bit more, and we already kind of try to sell a lot of like the counseling as more of like coaching, I think, to a lot of patients, because they just seem to be more inclined to take us up on it in that regard. But if we can talk about quality of life and incorporate that, I think people may be even more excited about it. If we tell them like practical strategies for improving your quality of life and that sort of thing. So.
I'm sorry.
I would say a lot of these guys haven't been here long enough to know what pastor was, but when we tried to implement that, the thing that I thought was the strong point of it was you had to identify 3 things that you wanted to improve, like it could be anything, play with the grandkids, walk to the mailbox, and start to measure success as you approximate those goals rather than what you do to the pain scale.
What did you think of the core quality of life concept? So love, work, health, place, and quality of time.
I think it's important. I think if you look at particularly in the implantable device space, because the rating of pain is so subjective, a lot of that has blended in quality of life. And when I look at that, if you measure opioid use, that really isn't a good measure because it never teases out. For example, you might make my knee feel better, but that's not going to help my neck and shoulders. So you have to know why they're taking the medicine and then why they decrease the dosage, rather than assuming it was because of your intervention. But quality of life is an important thing now to prove success in pain interventions, possibly because it's perceived as more objective than subjective. If I'm not going to work and now I'm going to work, that's an absolute.
Yeah.
Whereas if I was a 10 and now I'm a 6,
That's subjective.
I'm not sure what that means.
Yeah.
And I had another note, and I don't know, maybe I'm just too crazy. I was wondering about contentment versus satisfaction. So, when you were saying all that, you can be content, I think, and not be satisfied. And your contentment can improve, and I'm winging all this. So if I want to achieve a goal, but I'm content where I am and attempting to achieve that goal, that's that level of contentment. But if I achieve that goal, then there's an increased level of contentment, but still may not be satisfied because then I'm going from that goal to another goal. That's, I think the key to what you were saying is to take control. And most of what you do is control, isn't it? You lose control and then you try to regain control. That's, I think, true of most mental illness, whether it's chemically or psychologically. You get control back, you feel better. But I don't know. I have to flesh that out a little bit. I think you continue to be reaching for more, but still be happy that the journey is fulfilling you.
Well, so it gets the concept that Muhammad says patience is the key to contentment. But some people argue that contentment just steals away ambition. If you feel too content, you're not going to strive for more.
Well, I think that might be kind of what I was trying to say, but didn't do a very good job of it.
Well, you're saying you can't be content and still strive.
Right, yeah. I think there's always room for improvement, to be cliche about it. And if you start to measure it across those 4 parameters, then I think you have targets. And I think if you have a goal and a target, then you have a sense of purpose, which is important to a lot of things.
You know where to focus your energy.
Instead of laying in bed all day thinking about your back, you're going to think about, well, how am I going to get healthier? Or how am I going to stop my feelings of pain and sadness from boiling over into my family, kind of thing.
This is just a reference.
No, I think the core idea is good because when you put the big pinwheel on there, I think that could be overwhelming for patients, even though it's definitely true. All those areas are important, but the core, I think, it reminds me of the pyramid, like the different needs.
Maslow's hierarchy of needs.
Yeah, so it's like, first you got to do this and then you got to do this. So I think the core maybe is what the things to focus on initially. And then once you get that better in balance, then you can maybe bring in some of the extra areas and fine tune those other things. Because if people don't have their physical health, their mental health, then it's hard for them to have their, maybe their relationships, their social activities are not gonna fall into place majority of the time, I think. But yeah, I like the concept.
Thank you.
Dr. Hirschler, this is Corinne.
Yeah.
Do you find that there are patient characteristics that certain patient characteristics in people that respond better to the empowerment counseling, or maybe even have an adverse reaction negatively to the empowerment counseling? What has your experience been thus far? So when we're evaluating patients, who should we send to you? Who should we, think about doing something else with? What are your thoughts?
Well, there are some tricks to empowering somebody. So if you're more powerful than they are, and you're teaching them about empowerment, that's not going to be as empowering as if you hint at it and they discover it for themselves.
Okay.
So does that make sense?
Mm-hmm. Mm-hmm.
Now, some people are more receptive to learning ideas and concepts, and some people are more receptive to developing their own kind of concept. So you have to kind of figure out what the patient's style is. But I think empowerment is good for everyone. So
I agree.
That's the nicest thing you can do for somebody, in my opinion. If you empower your child, it's a blessing to them. So people like being empowered, but some people, you don't want to be a condescending, empowering person. You want to instill empowerment in someone.
Is there any thought about having this kind of empowerment counseling group therapy for patients without addiction issues, just with pain?
There's no literature. The empowerment counseling doesn't have a literature. This is a new concept that I'm kind of working with. The way I found it is I was looking at the wealthiest parts of the country and looking at what addiction programs offer in the wealthiest parts of the country. So I was looking at Atherton, California, and they had in one of the rehabs, or I forget it was a rehab or a substance abuse treatment facility, said they used empowerment counseling, but then when I looked up empowerment counseling in the literature, there's really not much there. And so it's kind of a new idea. And I thought, wow, that's such a brilliant idea. And so I've been developing it myself.
Zip code is the #1 predictor of whether you're going to do well after a significant illness or injury.
Yeah, the social determinants of health. It's interesting. So what can we learn from that about zip code? What are the aspects of it?
Well, when you talk about healthcare disparity, I mean, it goes right to the heart of healthcare disparity. A lot of the reason those individuals do better is they have more resources in that particular area to draw upon. That's part of it.
I think it's the whole philosophy of the people that are there, that they're grittier, they've had experience with troubles and been successful. Look how successful they are. That's why they're in that zip code.
That's true. I'm not sure you're able to say that in public, but yes. You'll be labeled an elitist.
Any other questions? Was this helpful?
Very good.
Would you be able to send out? I'd like to get the names of some of those books and that type of thing. Are these proprietary slides, or would you be willing to share?
Yeah, I'll share my slides.
Okay. Thank you.
Kelly, you can just forward them to them.
That's fine.